Hello everybody, welcome to my video conference. I'm Dr Mehdi Fathi Associate Professor of Cardiac Anesthesia in Mashhad University of Medical Science. Also, I'm board member of Iranian Scientific Society of Clinical Hypnosis. And in this video, I will describe and discuss about neuroscience issues of hypnoanalgesia. Before that, I would explain about hypnosis as an brain state. What is brain state? During day and night, and even when we are sleeping, brain states would be changed many times. When we are discussing about brain state, we are discussing about changing of metabolism of brain and also brain waves. For example, when you are awake and you are concentrating on something, your brain waves would be in high frequency state. We call that beta waves. And when you are in calmness, your brain wave shifts to slower frequency rate, and we call that alpha state of brain. Brain state also included change of regional cerebral blood flow and global cerebral blood flow, and also cerebral perfusion pressure, and some metabolites included consumption of oxygen and consumption of glucose, and exchange of glucose and carbon dioxide, and also at the final step, release of so many neurotransmitters as like a dopamine, as like a norencaphaline, enkephalin, and norendorphins, and these are known as brain states. And hypnosis is an attentive receptive brain state. What means attentive receptive brain state? This is the brain state that in this situation, attention is too high, and also reception of so many concepts would be better, and narrowing of attention would be present. Narrowing of attention means that you are thinking about so many things, but not focusing on some things. And in narrowing of attention, you focus on just a little and focused material and focused subjects in your mind, or objects out of your mind. This is absorption. This is called absorption, and means narrowing of attention. This is your wide attention, and now you are absorbing on just only matter and just only mention, and this is absorption. If you continue to absorption, then you will dissociate from environment and from peripheral awareness, and combination of absorption and dissociation would be result to hypnosis and hypnotic state as an attentive receptive brain state. And now brain is ready for gathering some data that you as hypnotherapist would be applied. For example, hypnoanalgesia, for example, distraction of the brain and of the mind from operation room to other places and comfortable places, for example, walking in the sea, walking to the garden, and getting rest in your bed. Now, I would explain in some few PowerPoints what happened in the brain and neuroscientific issues when you are putting the patients in hypnotic state. and my focus would be on just only hypnoanalgesia. Now, as you know, hypnotic phenomena would be involved cortex and subcortex, and also basal ganglia of the brain. And this process involves both of hemispheres, not selective right hemisphere or left hemisphere. Both of hemispheres would be engaged in some imagination. For example, when you are swimming or you are walking around the beach, your thinking and also your emotion would be engaged with together. Your thinking would be guided by your left brain, and your emotion would be engaged and guided with your right brain. And hypnotizable persons have more effectively and flexible frontal, attentional, and inhibitory system. And this is process of hypnosis that absorption to some imagination would be guided to another imagination, and so many imaginations and also associations would be joined together. For example, imagination of the sea would be joined to association with swimming, or comfortable situation around the beach. And this is not arousal for pain association. And this is secret of hypnoanesthesia or hypnoanalgesia or hypnotic suggestion for pain control. Dissociation from pain sensation and absorption to so many association that they are painless association. During selective attention, frequency increases during induction phase, and you go to higher activity of brain waves. But if selective suggestions produce to the patient, for example, comfortable situation, not arousal situation, these brain waves would be felt down and goes to reduced speed and goes to alpha state and alpha wave. And this is, for example, in neutral hypnosis. Neutral hypnosis doesn't arousal state for sympathetic or parasympathetic stimulation. During hypnotic dreams and also age regression, alpha waves amplitude is decreased. What is age regression? Age regression is putting the mind of patient to past time, for example, in childhood or in high school, for recalling so many memories, or handling some memories. For example, in traumatized patients, we put the patient in age regression state and then handle the memories, or we work on coping skills of the patients for handling bad memories, and so many techniques would be applied in this period and in this phase, as insight therapy and cognitive therapy would be applied in this trans-hypnoidal state. We call that trance work. After pre-attack and after induction and after deepening of trans-hypnoidal state, you go and you direct the patient to trance work. Trance work would be cognitive therapy under hypnosis, would be coupled therapy under hypnosis, would be age regression under hypnosis, would be insight therapy and change of bad memories in traumatized patients, also in transhypnoidal state, and is called to transwatch. And another change would be happen in event-related potentials. Event-related potentials, for example, during hallucination induction would be reduced in P100 or P300. And during hallucination induction, P2 and P3 amplitudes would be reduced in parietal cortex, but not, for example, in occipital cortex. When you are inducing some auditorial memories or auditorial imaginations, this phenomenon would be changed so many changes in parietal or temporal cortex. During hypnotic amnesia, P1 and N1 and P400 amplitudes would be reduced. These are not all of conditions of hypnosis and brain during hypnosis. These are just only so little examples of change in event-related potential and evoked-related potential. These are included the brain state we have under hypnotic state. Hypnosis is not just only suggestion. It's suggestion guided to the brain to have so many changes in metabolism and also in event-related potential and cerebral blood flow, and also, as you saw in previous PowerPoints, so many changes in brain waves. During hypnotic analgesia, negative event-related potential, as N200 amplitudes, would be reduced, and this would be in left anterior temporal cortex. In cingulate cortex, you can see higher activity in getting in anterior portion related to emotional state, and in posterior portion of cingulate cortex is related to affective process. And middle zone of between anterior and posterior portion of cingulate cortex at the middle zone is related to cognitive emotional process. And the pain is somatosensory emotive experience. Then when you succeed to change emotions, you can succeed change meaning of the pain and also feeling the pain, and also you can change somatosensory transmission from peripheral nervous system to central nervous system, and after that to perception threshold would be changed in cortex. Also during hypnoanalgesia, regional cerebral blood flow is increased in frontal cortex, and during visual hallucination, this regional cerebral blood flow would be increased in occipital cortex. Attention please to during visual and during auditory hallucination. Visual hallucination during hypnotic suggestion would be included that regional cerebral blood flow would be increased in occipital cortex, but auditory hallucination in hypnotic state would be changed in regional cerebral blood flow in temporal cortex, especially in right temporal cortex in comparison to the left, because imagination is related to right cortex as overcome cortex in maybe more than 900% of people. Another finding in hypnosis is related to so many changes related in neurotransmission, neurotransmitters, and also in so many metabolisms. For example, hemovalinic acid would be increased in CSF and in cerebral spinal fluid. And skin conduction would be increased, and sympathetic tone would be reduced in comparison to awake situation. And this is higher than tonicity of sleep condition. Because of this, on the basis of these documents, hypnosis is not a sleep state. Hypnosis is a separate state itself. Hypnosis is a brain state as well. And when you are practicing hypnosis spontaneously, so many changes would be applied in the brain, in sensation, in perception, in cortex, and all of these guide to painless situation, and this would be directed with you as hypnotherapist. Of course, this video was too short, and I couldn't explain everything about hypnoanalgesia in this short time. I hope see all of you in another practical workshops and explain about every opinions and every issues of hypnoanalgesia. And right now, I have done so many surgeries without anesthetic drugs and without local or general anesthesia, just only by hypnotic suggestions. And all of surgeries were so big surgeries, not small surgeries. For example, hand device removal surgery and reconstruction of an anterior cruciate ligament of the knee, and also lipoma removal with using tourniquet inflation and also with using of electrocauterization. And these are all of these are so noxious stimulus, and the patient is in awake state, and all documents, for example, by spectral index monitoring shows awareness score and full awake of the patients. And patients can talk with you, with surgeon, and with staff of operation room. And these are shows to us that hypnosis works as analgesic approach, and you can use this phenomenon for so many patients that you are select them as so many people that they are contraindicated for anesthesia or for local anesthesia or general anesthesia, and you can use it. Then please pay your attention to power of the brain and discover more than this power of the brain. Thank you for your attention, and hope to meet you very soon in everywhere in the universe. Thank you, bye.